Hi, I'm Dr. David Smotrich. I'm the founder and medical director of La Jolla IVF. I'm going to talk to you about gestational surrogacy today and evaluation of a gestational surrogate. By definition, a gestational surrogate should be a woman who's had no problems getting pregnant, and prior to her evaluation here with us, we call for all of her old medical records to make sure that indeed there were no issues with her getting pregnant, no issues with her previous pregnancies, issues such as elevated blood pressure, diabetes, thyroid disease, kidney disease, premature labor, premature contractions, hospitalizations. Once we have all these old records, we also ask her to be evaluated by her obstetrician to make sure that she's indeed a good candidate. After she's gone through all of these evaluations, she comes to our office for a physical evaluation. When she comes here, we re-review everything in her health history. Again, focusing on environmental things to make sure that she does not participate in any things that would be detrimental for her or for a fetus during pregnancy. Things such as alcohol, tobacco, drug use. In fact, we do urine drug screening for alcohol, tobacco, drug use, and tobacco breakdown products, because it's not just enough for her to be a non-smoker, but if she lives with a smoker or works in an environment when there's a lot of smoke, she will have breakdown products of tobacco within her system. In addition to these types of things, we do a body mass index. Unfortunately, in the United States, we have an obesity problem, and when women are having a body mass index above 30%, they are at very high risk for having a high-risk pregnancies. When the body mass index is above 30%, it's very clear that they have a higher risk for elevated blood pressure during pregnancy, diabetes during pregnancy, as well as intrauterine growth retardation for the fetus, so the fetus does not grow and thrive in that environment. They have a risk of premature delivery and sometimes even death of the fetus that is unexplained. So this is all something simple to weight. So we put all our surrogates on the scale as well as their height to make sure that we can measure the body mass index. In addition to this, I look inside the uterus by placing a small telescope through the cervix into the uterus to make sure that there's no scarring or polyps on the inside of the uterus, to ensure that the surrogate's uterine environment is healthy for a fetus to grow and develop. In addition to this testing, we do blood and urine testing required by the state of California, looking for things like HIV, hepatitis B and C, HTLV1, syphilis, gonorrhea, chlamydia, West Nile virus, cytomegalovirus. If the woman has a male partner, we test the male partner for all of those things as well. The purpose is that there are times when the woman will not be able to have any sexual relations with her partner. For a surrogate case, generally this is about 3 months from the time we start meds till the time that she's clearly pregnant. But there are benign things that a gentleman could pass to the wife as an infection that has nothing to do with sex. When testing a surrogate, we always test the surrogate for thyroid, as well as making sure that she is rubella immune, as well as making sure that she is vaccinated for hepatitis B, so that the child and the woman is protected from any hepatitis infection or for an infection with rubella, as well as that the thyroid is normally functioning. The thyroid gland is very important with regards to metabolism, and so when a woman has a low thyroid, she has a lower likelihood of being able to get pregnant and have a healthy pregnancy.